Before we started the big push investments in Nairobi, there was only one clinic with 15 beds serving 500,000 residents of the Mukuru informal settlement. Meaning that when a mother delivered a baby in Mukuru, she had less than 1 hour of postnatal care before being asked to leave to make way for the next patient. This is the poverty of dignity. We have fixed this indignity by building 25 hospitals in our informal settlements of Nairobi to ensure that our mothers do not need to go through that kind of indignity again. Let me give another example. When a patient suffering from kidney disease had to travel for 70 kilometers from Siaya to Kisumu 3 times a week for dialysis, that was a tragic indignity. But further, the tragedy of this indignity was made worse because the patient needed 10 dialysis sessions a month, and if one session cost between Kenya shillings 9,000 and Kenya shillings 16,000, it meant that the patient had to spend between 90 and 160,000 shillings per month. How many farmers from Siaya can afford 160,000 every month for dialysis? Such patients had to sell their ancestral inheritance in order to get treatment. The net effect of this was that their illness ended up diminishing their families and indignifying them for generations to come. Today, I am happy to note that a patient from Siaya no longer has to travel 70 kilometers to Kisumu for treatment. There are dialysis machines in Siaya at the sub-county level. Similarly, he does not have to pay 160,000 a month for dialysis or sell his ancestral land. All he needs to do is to spend 500 shillings every month on an NHIF card, and this card gives him free dialysis every month. If dignity is freedom from want, then we have restored it using our health interventions, as I have just stated.